It is Monday, November 30th. I almost said Friday. Last week was a short week and a very odd one. My name is Randy Murphy. I'm an epidemiologist and the Director of Disease Surveillance at the Mobile County Health Department. I'm here on Facebook Live to give you the update on the effect of COVID-19 pandemic on Mobile County. We generally start with some worldwide stats and then get into some of the tidbits that I try to share with you about what's happening in Mobile. So worldwide, over 63 million deaths with near 63 million cases of COVID-19 with nearly 1.5 million deaths. The United States still leads the world in the number of cases and deaths. They followed by India and Brazil. In the U.S., in the past week, an average of 160,000 cases of COVID-19 a day were added to our national counts, and around 1,400 deaths added daily. Those are national figures. So this is a really, another really accelerated time of our pandemic in the United States. In Alabama today, almost 250,000 cases reported with 3,578 deaths. So again, just really going back to seeing counts that we have not seen since July when we had our first big spike. So today in Mobile County, our daily report, produced in collaboration with SSI Group, reports 20,052 COVID-19 cases. I believe we actually hit over 20,000 cases if we had reported yesterday. Yesterday, 48 cases were added. We have 364 that have died. 0 were added yesterday, but a couple, I think, since we talked to you last week. The cumulative number of people hospitalized with COVID-19, it stands at 2,633. 15 were added yesterday. And the daily number of people hospitalized with COVID-19 is 120 on yesterday. That was an additional 4. So just going back, it's been, I think last week we only talked with you on Monday because of the Thanksgiving holiday, and we had already begun to see a slight drop off in the number of cases reported after the 2 weeks following Halloween. So we saw a big jump in the number of cases in the 14 days following Halloween. That 2 to 14 days, the incubation period where we expect to see people get sick with COVID if they were exposed over the holiday weekend. So we had gotten past that point, starting to see a little bit of a drop off. And then, of course, Thanksgiving being a holiday, kids out of schools, places closed on Thursday, some laboratories closed on Friday. We had one urgent care facility who ran out of COVID tests and was no longer able to do COVID testing. So going back last week, so on Monday, we had 141 cases reported, 123 Tuesday, 111 Wednesday. Then on Thursday, on Thanksgiving Day, just 33 cases were reported. Then on Friday, 170 cases were reported. That was the biggest increase we had seen for at least several weeks. Then 44 cases reported on Saturday and 48 on Sunday. So it will take a few days before our numbers, even out a little bit, where the effect of the holiday really sort of, places being closed, the effect of that sort of, we get over that hump. But we are going to start seeing, likely, I'm predicting, record numbers of cases that are going to be reported of us over the 14 days or so after the Thanksgiving holiday. We've already started seeing lots of people who chose to travel over the holiday or have large gatherings over the holiday come up with large numbers of people positive at family gatherings, other types of large gathering and event, and then again related to travel, either a family member coming to visit them from another state or people traveling to other states for visitation. So just a little bit about our weekly report just came out a little bit ago, just to highlight, Mobile County, Alabama, nationally, we are still seeing an accelerated increase in the number of cases and the number of hospitalizations and the number of deaths. today on a statewide call with the Centers for Disease Control. They mentioned that 80% of jurisdictions are headed in the wrong direction, something that they're really concerned about, as we all are. And again, we're keeping a close eye over the next 2 to 3 weeks as we see cases pop up that are a result of gatherings during the Thanksgiving holidays. So if we look at our case count by report last week, it was a little bit down when compared to the week before, again, holiday. And if we look by the infectious date, also a few cases lower than we had seen the previous week. But that is expected because we had, again, a lot of kids out of school, a reduction in the amount of tests that were being conducted around town. Generally, people don't go to the hospital or don't seek urgent care on Thanksgiving Day or on, football Saturday unless they absolutely need it. So overall, the number of cases from November, the number of confirmed cases will be an increase over October and an increase over September, and we expect that trend to rise. So anything you can do, if you were traveling during the holidays, if you were around a large gathering, please stay at home to avoid potentially becoming infectious in the 2 weeks following that gathering and unknowingly infect others with COVID. See, I think all I really wanted to say I just wanted to remind everyone that the hospitalizations are definitely going up. We're seeing, any day on average around 120, high 120s hospitalized on any given day. And those are numbers that we have not seen since early to mid-July. So we are very concerned about our hospitals filling or closing or nearing capacity for intensive care units, that sort of thing. We're good on ventilators. We had lots of ventilators that were brought into the state by the federal government. So I think we're in good shape there. And as the number of ICU beds if there continues to be a need for increased ICU beds, I have no doubt that our hospitals will be able to expand to meet those needs. Deaths were a little bit down last week. Again, probably a reporting aberration because we had lots of people out for the holidays. The percent test positive, so the percent of all tests that are positive for COVID, the statewide system, which reports mostly PCR tests, was down around 7% last week. That will probably adjust up as additional data comes in. But if we look to our urgent care centers and our rapid testing locations we have 3 locations that report to us just because it's the right thing to do, report to me in aggregate weekly so that we can get an idea about what they're seeing. And right now they're seeing anywhere from 12 to 15 to 20% positive in the locations that are doing rapid testing, where they're probably seeing the most people who are at risk of COVID or have COVID. I talked a little bit on the radio last week about someone kind of questioning, the death rate is so low. You're right, the death rate is pretty low. Overall, it's around 1.7%. But if you look at people 50 and over, the rate is 88 deaths per 100,000, and 65 and over, the death rate is 426 cases for every 100,000. And just looking at the percentage, if 2% of our cases so far have died, if everyone in the county were to get COVID, we'd have another 4,000 deaths or so. So it is a small death rate. We're thankful for that. But again, it's not a reason that we would quit trying to prevent cases of COVID, right? Anytime we can prevent disease, then we have the possibility of preventing mortality. If we can prevent deaths, for at least a little while to prolong a good life, then that's certainly what we want to do to keep our loved ones and our friends around us longer. So looking at the schools, again, last week was a little bit of an oddity because many schools were out for Thanksgiving. Most were out, but we still saw an additional 70 cases new cases from schools, 15 schools with at least one new case. A bunch of schools that are having, outbreaks in the student population. So kids of school age where we have multiple cases in schools. So we will continue to keep a close eye on that. And then the zip code map this week, again, we're seeing the most dense number of cases reported per capita in the zip code of 36572 and 36611. So if you're in those zip codes, there is more COVID there per population than anywhere else in the county. So please heed our warning to stay at home, stay safer at home to the greatest extent possible. Okay. Last week on Wednesday, the indicator dashboard, so the map that looks something like this, was updated. Mobile for last week was in the moderate risk categories because, and this risk indicator dashboard is based on the date that the case was infectious, not necessarily the date that it was reported to us. So it's slightly different data than we sometimes look at. But we went down in risk level because our number of cases for the prior, this is like 2 weeks ago data, had gone down slightly. Again, after that 2-week window after Halloween, we started seeing a slight decrease in the number of cases. But we still are seeing more cases now than we were before our spike in July. So it's sort of a relative measure. Like just looking at the change day over day doesn't tell you a whole lot. To look at it in a 2-week period is helpful. But again, we have to also compare to our historical data, and we are having as many cases and as many hospitalizations as we were seeing in July, and that's frightening to me and my staff. So a couple other things that we talk about for the week ending the 27th. So this was last week when we had a slow week. We had complaints against 4 food service permitted food service establishments and 2 daycares. And then just to remind you, I get asked this quite a lot, we have outbreaks in 10 nursing homes, 1 assisted living, a specialty care location, another special setting with congregate setting with highly vulnerable populations. We also have a detention center that's having a few cases. All things we starting to see outbreaks again all over the place because we have such high community transmission going on right now. And then other locations like shelters, and we have received complaints and we've consulted with companies like wireless communications, with fuel services, with big box stores, with 5 or 6 different schools, with restaurants, attorney offices, churches, shelters, all of these places that are experiencing cases, reporting them to us or someone complaining, and then we give them a call, trying to help them identify and control an outbreak either within their workforce or within their customers, whether they are students or whether they are workers or clients or residents or patients. That's what we try to do, is to try to help people identify the introduction of COVID, the spread of COVID, in an effort to try to slow the spread and control the outbreak. All right, here are a couple questions from the media. Someone was asking if I knew if cold weather shelters were going to be opening tonight because of the downturn in the thermostat. We're seeing quite some cooler temperatures than we are used to compared to last week. I don't know of any new shelters that are going to be opening, but we did reach out today to our partners at Housing First and other shelters like Waterfront Mission and Salvation Army and other places to try to let them know that we know COVID positive is a barrier to sheltering. And so we don't want anyone to be turned away from a safer shelter if they need it in times like these, whether it's cold out or you've fallen on hard times, you don't have a place to go, or you really need to be in a recovery treatment center or something of that nature. If you need hospice, if you need respite, we want you to be able to get that care. So we tried to get the message out today to say the health department, the Mobile County Health Department, can provide rapid 30-minute testing, COVID testing, for anyone who presents at a shelter tonight or this week where a negative COVID test is required before admission to a shelter. So we're trying to do our part to participate with local shelters to try to make sure that shelters can open safely and that people who need that respite can get it. Let's see, someone asking about the amended Safer at Home order. It currently expires on December 11th. Do I have any information or any hopes in regard to the extension of the mask mandate? I don't have any preview of what the governor is going to do. We certainly are keeping a close eye on the data and expecting that unless things take a major turn for the better, that we are likely have no strong justification for loosening or lightening or lifting the Safer at Home order. So again, you may see some components of it tweaked, but again, we are heading in the direction that we were in July at the very peak of our outbreak in Mobile, before the Safer at Home mandate went into place and before the mask face covering became a requirement. So we really need you to keep covering your face, staying at home, having that 6-foot physical distance between you and others that don't live with you, to try to slow the spread in our community. You know, in the summer, most people were out of school, a lot of people were out of work, we weren't having gatherings, all of those kinds of things were suspended. We have the mask order, that's good, but you know, the limit on the number of people who could be in an outdoor gathering has been lifted, and so other things, you know, alcohol sales were lifted, so other things have been lifted that have made it more of a challenge for us to control the spread with just a facial covering and 6 foot of distancing. So those are your two big things for to help you, and stay at home if you're sick or if you're exposed, and wash your hands. Okay. Someone commenting, I think just to follow on to that question, that some people were hoping that the governor would decide what to do after December 11th so that people could make some decisions about gatherings like Mardi Gras balls, Mardi Gras parades, conventions, those sorts of things. But I don't think we're going to get an amended order any sooner than next week. Someone from the media asking if I could address the hospitalization rate for the county and any concerns we have about that. Yes, we are concerned about the rise in the daily number of patients hospitalized in Mobile County with COVID. Right now it stands in the mid 120s. It has been in the mid 120s daily for the past 4 or 5 days. This is as high as we saw in early July. We know that even in July, when we got to around 200 and 210 cases of COVID in the hospitalized each day, our hospitals were able to adapt with that. We know that back then they had some different things into place, like they weren't allowing visitors, they'd canceled elective surgeries, those sorts of things. So if it is needed, I feel like our hospitals will do the things that they need to do to try to adapt so that they are not overrun with the need for ICU beds or ventilators, that sort of thing, as our COVID numbers continue to rise. But we can all do our part to keep the numbers low, to slow the spread of COVID-19 and protect those that might have severe complications that require hospitalizations by covering our face when we're out, staying 6 feet away, people who don't live with us, staying at home if we're sick, staying at home if we've been around someone with COVID, washing our hands, covering our cough, all of those things that we all, you could repeat them, I'm sure, as well as I can at this point. We've been talking about it so much. Let's see. And then a Facebook question about different types of illness. So some people with COVID have no symptoms at all. Some are mildly ill, others have more cough, others have more fatigue. Yes, it's going to look slightly different in a lot of people. And the question was, how do they know when they can get out without making people sick? And the overwhelming data shows that after 7 to 10 days after having COVID, you're no longer infectious to others. So that's why we say isolate for 10 days after your first symptom or after your first test, and continue isolating if you have symptoms. But if you had a symptom and 10 days later you're feeling well, you are totally back to normal health, or you had a COVID positive test and you never had any symptoms to begin with, then after 10 days, you can discontinue isolation and feel pretty confident that you're not going to spread it to others. That's the best that we can do with the existing science and recommendation right now. So with that, I will end my update. We do expect there to be some changes in the CDC recommendations for quarantine. So that should be published within 24 to 48 hours. We will talk about it on Friday after it's been published. I got a little preview today on the statewide call, but I'd rather not talk about it until the Centers for Disease Control publishes that guidance. And again, it will be slight changes to the duration of quarantine, and we will talk more about that on Friday after we see it in black and white. So stay well this week. Stay at home if you were at a large gathering over the Thanksgiving holidays, or if you traveled. Please try to keep from spreading COVID-19 around our community, and do everything you can to keep yourself safe and to maintain and promote health and wellness of those around you. So thanks, and we'll see you on Friday.